Exposure to bushfire smoke during this season's crisis is having a hazardous effect on people's health, leading to patients ending up in hospital.
The Health Department warns vulnerable people are particularly at risk and advises them to stay indoors where possible. Joining us live now is respiratory physician and AMA Federal Vice President, Dr. Zappala. Thank you so much for joining us, Doctor. Let's start firstly with the AMA. They put forward the health concerns to the Health Minister, Greg Hunt, and this week announced the $5 million funding for research. Are you happy with that outcome?
Look, it's definitely a good start. I mean, we know that people who have brief short-term exposure to these smokes and dusts have problems, and of course we know that long-term exposure has problems associated from a cardiac and a pulmonary point of view. What we don't really know very well is for this type of event that we're seeing in Australia at the moment, whether there is going to be longer-term consequences for individuals, and this money will be a very good start for Australian researchers to help answer that question.
Dr. Chris, we saw the rise of masks being worn up in Asia after the various viruses that we've seen there. A lot of people are getting around the streets in cities and other parts of Australia with these masks on. Which ones work and which ones don't? Are any of them just superfluous?
Unfortunately, many of them are just superfluous. The paper ones and the more flimsy ones are really not that good at all, because of course the biggest threat to us are the really tiny microscopic particles that can get right down into the lungs and even be absorbed. And so you need a mask such as the P2 one, and all of the state health departments have got details about these masks on their websites, and they're used industrially, so you can get them from hardware as well as pharmacy shops. But those masks are the more appropriate ones. But again, they can't be used for long periods because the moisture in our breath, and as we handle them, and of course if we fiddle with them and take them off, they become less usable. But that's the one that if people are really concerned, if you're in those high-risk groups, then you should, and you have to go outside obviously, then you should try to get hold of them. Otherwise, I think you're probably not adding too much extra protection, unfortunately.
And this week we also heard about a study that found after 45 days of smoke inhalation that pregnant women were more vulnerable to gestational diabetes.
Yeah, look, I'm pregnant women, unfortunately. There's a lot going on, obviously, there in pregnant women, and they're in a high active, high stress state. And unfortunately, they are at greater risk along with the more elderly, the people with known chronic lung diseases or chronic heart diseases, and obviously infants. And we really just need to be as sensible as we can and only go outside when we have to. And of course, if you've got unexplained symptoms or if you've got known disease and you do not have good control of your symptoms, then please do get along to see your local doctor. It's
unprecedented, isn't it? We've seen sporting events finished, wrapped up because of the quality of the air. It took, look, and I'm not making an analogy here, but it took a long while before asbestosis and mesothelioma was linked to asbestos, in just recent years. What are your grave fears in and around the pollution that we've seen over the past few months?
Well, I guess they have to be divided into short-term and long-term. And in the short term, obviously, we're worried about people who have known respiratory illness, for example, as you're showing at the moment, who've got asthma, for example, and have exacerbations of their symptoms, and they'll need more help and extra treatment. But in terms of the long-term effects, obviously it's an unknown, and that's where that research money will be more helpful. Of course, it is possible that we will see higher rates of airways disease, and I guess it's possible that we might see higher rates of cancer and other cardiac disease, but that is by no means certain, and we just have to look at that over time. Unfortunately, like with asbestosis and mesothelioma, there is going to be a lag time between exposure and when people develop disease. And so vigilance is really the key in terms of the medical system and patients. If you've had this exposure and down the track something doesn't seem right or feel right, then that's going to be something you need to discuss with your local doctor.
And we have been hearing reports, Sydney has had 10 times a hazardous amount of smoke. Early December, we were getting reports from authorities saying the conditions were equivalent to smoking 34 cigarettes a day across Sydney from the fires across near Warragamba Dam. And of course, as Tim mentioned, a lot of sporting events have been cancelled or moved. In terms of the risks that we can minimise at the moment, we've been speaking about face masks. What about things like shutting doors and windows? How effective are they?
I agree with you. All of the simple stuff needs to be undertaken. So obviously if we don't need to go outside, we shouldn't go outside. If we can be in filtered air conditioned environments, then we should do that. We should minimise our travel, check on friends and colleagues obviously. And if we do absolutely have to go outside and you're particularly in one of those high risk groups, then wear a mask. If you know you've got asthma, then get stuck into your action plan, increase your regular inhaled treatment, give yourself that extra protection. And I think we just have to apply common sense as much as possible, obviously. And of course, we really hope that as all of this settles, our airways will get a chance to catch up, and hopefully that will minimise the longer term impacts and people will be able to go back to their normal lives.
Doc, just finally, we've seen so many people, both paid and many volunteers working right on the front line here. So days and days and days, months of exposure to this kind of air. Are there any tests that they can take once things settle down?
Yeah, look, it's a really good question, and obviously there's no doubt that the more intense and obviously the longer the exposure, the more at risk you are going to be. It's difficult to know what the correct screening test for illness is going to be, but if we borrow from other industries and other scenarios, getting, for example, a simple chest x-ray and a spirometry or breathing test would be a good place to start. I don't want to suggest that people have to get those done because we don't truly know what the best way to screen for disease is, but they would seem like logical and appropriate places to start for people who have concerns or who have symptoms. So start with the simple tests and then be guided by that.